Umbilical hernia in under 5 minutes. A short tutorial for Discover Pediatric Surgery by Andrew Grieve, Karen Milford and Nirav Patel. Umbilical hernias are the most common congenital abdominal wall disorder. Essentially, an umbilical hernia is a covered fascial defect at the level of the belly button. Umbilical hernias are found in up to 25% of children at birth, and the main risk factors are Black African race, prematurity, low birth weight, syndromic genetic disorders like trisomy 21, and hypothyroidism. The diagnosis of umbilical hernias is clinical, and it should not be confused with an epigastric hernia, omphalocele, or hernia of the cord. Management is dependent upon a patient's age and symptomatology. Any patient under the age of 5 or who is asymptomatic is a candidate for watchful waiting, as umbilical hernias are likely to close spontaneously as children grow. When managing patients with umbilical hernia expectantly, always remember to counsel parents on the danger signs and symptoms of incarceration, including vomiting, a painful red or hard hernia, or a distended tummy. Should parents notice any of these signs or symptoms, they should take their child to the nearest health facility immediately. Also remember to advise parents not to apply any compressive dressing to the hernia, as doing so will not prevent incarceration or assist in spontaneous hernia closure. The diameter of an umbilical hernia should always be measured at its base. Be wary of those children with a narrow hernial defect because of their increased risk of incarceration, and those with a defect greater than 1.5 centimeters in diameter, as these hernias are less likely to close spontaneously by the age of 5. Children over the age of 5 or those with symptomatic umbilical hernias should be managed surgically. Symptomatic umbilical hernias include those with a previous history of incarceration, with pain attributable to the umbilical hernia, or a proboscoid or trunk-shaped hernia causing the patient psychological distress. Umbilical hernia repair is usually a day case procedure with a low rate of complication. Minor complications include pain, scarring, bleeding, and wound infection, whilst major complications include hernia recurrence and off-site injury. Remember to inform parents that the risks of surgery are less than the lifetime risk of incarceration if no action is taken, and thus surgery is indicated. Surgery is usually performed by means of a small infraumbilical semilunar incision, and children usually return to normal activity within 3 to 4 days. If parents notice any danger signs including fever or vomiting, severe tummy pain, or excessive redness, discharge, or bleeding from the wound, they should return for review immediately. In those children with no danger signs, dressings can be removed after 4 days and the child can bath normally. Always remember to explain to parents that the swollen and boggy appearance of the umbilicus postoperatively is due to excess umbilical skin, and this will take about a year before it settles down and looks more normal. Thanks for listening, and please access the Surgeons for Little Lives website or Discover Pediatric Surgery podcast to download and share this and similar tutorials for free.